Hi, I'm Mike Riccio, and today we'll be taking you through a short series of shoulder exercises. We will begin with what we call Phase 1. The first exercise will be a pendulum or a Codman exercise. Here, the patient stands kind of sideways to a table or a countertop, something that does not move and is immovable. We don't want to place your hand on anything that has wheels or that can move. And so once your hand is on the tabletop, we'll have you take your shoulders and square them to the table and feet about shoulder width apart. Slight bend of the knee, and then trying to get your torso so it's parallel to the ground. Here with this movement, it's going to begin with your body. So your knees and your torso are going to move the arm. So the arm is an extension of the body. So as we begin this motion, it can go clockwise or counterclockwise. The patient can draw letters, numbers, any type of movement, but what's most important with this exercise is that it be guided by the body. Excellent. Exercise number 2 will be passive rotation of the shoulder. So here, the therapist takes a hold of the arm, one hand on the wrist, the other hand underneath the elbow. So what is important here is that the therapist or whoever is helping with the exercise begin to be able to feel the weight of the arm. So it's difficult at this time for the patient to relax, but as best they can, we want the patient to relax their arm and give the weight of the arm to the therapist or to the caregiver who is helping with this exercise. So the caregiver or the therapist should feel the complete weight of the arm in their hand that is underneath the elbow. Once in this position, the therapist will rotate the shoulder and the hand toward the belly. So this is a nice slow movement that has no restriction or has no precaution or endpoint. So it is safe to come to the belly as far as the patient can tolerate. So it's a slow motion in toward the belly and a slow motion out. The starting position here is a 12 o'clock or a 0 position. So if we come back to the 0 position, which is right here, now we'll go into what is called external rotation, or we're rotating away from the body. So we will have a limit of around 20 degrees of external rotation, or depending on the side, around 10 o'clock. So if we go back to the 12 o'clock position, this would be our 12 o'clock starting position. We would rotate out about 20 degrees, and our stop point would be about the 10 o'clock position. And then back to 12 o'clock. Excellent. Exercise number 3 will be passive flexion or passive elevation of the arm. And once again, the therapist or the patient or the caregiver will take a hold of the arm at the wrist and at the elbow. And what's most important is that the caregiver or the therapist feel the weight of the arm. It is difficult for the patient to relax, and it will be more challenging to move it until the patient relaxes. So best to spend 30 seconds or so to have the patient relax and feel the weight of the arm to begin. So as we begin to elevate the shoulder, we want to first flex the elbow or bend the elbow. This will take any pressure off the shoulder as we elevate. So we'll go ahead and bend the elbow and begin to slowly elevate the shoulder. There is no limit here to shoulder elevation. This is limited solely to the patient's tolerance, and pain is the guide. as the patient begins to elevate their shoulder, it is okay then to extend the elbow. On the return or on the descent, we'll begin to slowly flex the elbow again and slowly return the arm to its starting position. It's very important to slowly bring the arm back to its starting position. The patient will have a tendency to try to catch their arm with their own muscles or fire their muscles to slow the arm down. So as the therapist or as the caregiver, you're trying to prevent that by going slow with your return to the start position. So let's do it one more time, where slowly we're elevating the shoulder and flexing the elbow. Again, there is no limit. Pain is the guide. Then we return slowly to the starting position, bending the elbow on the descent. Excellent. The next exercise will be shoulder shrugs. Here, the starting position is with the patient seated with a nice tall spine, sitting as tall as possible, having the arms supported either in the sling or supported on a pillow such that the patient is not bearing the weight of the arm. And so here the patient begins to elevate their shoulders toward their ears, slowly up and slowly down. And we'll repeat that 3 times. So it's a slow motion up without limit and a slow motion down. All the while the shoulder is supported by the pillow in the lap or having the patient in a sling. Either would be okay to do. And the final exercise of this phase will be shoulder retraction. Again, with the shoulders supported in the lap with a pillow or in the sling, the patient pinches her shoulder blades together. With this motion, the shoulders stay low, away from the ears, and the shoulder blades pinch together. We'll repeat that one more time. Again, no limitation here. Pain is the guide. Excellent. This concludes phase 1.